Fibroid ni dangerous ke? Let us doctor.
So is it dangerous or not? So the fibroid, well, it depends again on the size of the fibroid and on the symptom the patient presented with. If the patient present with symptom, which is 20% of the patient present with symptom of bleeding, heavy menstruation, causing anemia, or sometimes because it's too big, the size is too big, it causes compression to the surrounding organ. Like for example, compression to the bladder. If the fibroid come from the front part of the uterus and it grows towards the bladder and press the bladder, and the patient may have symptom like going to toilet to pass urine so often, or feeling unable to empty the bladder completely. And also, if it grows to the back, or we call it posterior, it can also press onto the ureter, which is the channel that bring the urine from the kidney to the bladder. So if this get compressed, then it can cause hydronephrosis or dilatation of the ureter because the urine cannot flow into the bladder. So that over a time can cause kidney damage due to backflow pressure, high pressure to the kidney. And we have seen a patient presented with kidney failure, young women come with the kidney which is already damaged because she has a large uterine fibroid which is not detected and causing this damage. Some fibroid can also cause infertility, and also if the patient get pregnant, sometimes it can cause a recurrent miscarriage. This is because of the perhaps location of that fibroid. If it's in the uterine cavity, definitely it will disturb with the formation of the embryo or growth of the embryo that eventually will cause miscarriage or recurrent miscarriage if it is not removed. And also can cause infertility due to failure of implantation. If this fibroid is obstructing the outflow or distorted the cavity of the endometrium, the uterine cavity, so that itself can be one of the cause of infertility to some patients. There are certain type of fibroid who are quite aggressive and which can grow in size rapidly. So this kind of fibroid is not a good sign or not a good type of fibroid, because when it can grow at a very fast rate, so there's a chance that it can lead to a malignancy, or it could have become malignancy. Well, we don't know until we find out. But if you have a fibroid that grows big at a very short period of time, so malignancy is one of the very thing that we need to exclude. And not only that, because it grows very fast, so it also can cause a symptom to that patient. As I mentioned earlier, it can cause compression symptom in front to the bladder, at the back to the ureter, and also to the bowel at the back, causing constipation and also feeling heaviness and painful sexual intercourse, and many more to this patient.